Hello, this is Sungwat Lee. Today, I'm going to introduce the project that I worked on reading master's degree, which is topological study of dentinal tubules by two-photon microscopy. This project proceeded under supervision of Professor Kwang-Seok Kim. I believe we all have or will one day suffer from tooth pain. Among all the types of pain, hypersensitivity is far most often reported disease. It makes your teeth highly sensitive to outer stimulation. However, the pathological factors of this disease is yet to be found. So in this study, I will introduce the journey finding possible candidate for the factors. Before we start, I would like to give you a brief idea of structure. If you see on the left, there is a tooth. But if you look close enough, you will see there are three different layers: the enamel, dentin, and pulp. If you see the pulp, there is an odontoblast. When it forms itself, it reaches long branch and nerve fiber tangles around it. Consequently, the dentin have tubules, which is hollow tube, lying all the way up to the dentin-enamel junction. And the tubule is filled with fluid, so whenever the outer stimulation exerted, it flows. This flow creates a fluid pressure, which presses the nerve fiber back and forth. This neural discharge creates pain sensation to your brain. As the pain sensation is fluid dynamics, this flow will highly depend on tubular shape. However, the accurate shape of tubule is hardly studied, so in this project, I used two-photon microscopy to achieve better image of tubules. So I performed two-photon cross-section imaging with dentinal tubules. Tubules were filled with rhodamin 6G and excited by 10,064 nanometers of wavelength. It scanned for tens of micrometers in depth. After I gathered all the layers of image, I was able to create a video of the image. In order to reconstruct more accurate shape of tubule, I measured integrated intensity of each layer. Consequently, the intensity will increase proportionally to the amount of rhodamin in a layer. If you see the dataset on the left, you'll be able to see it draws somewhat Gaussian, highest at the center and lowest at the each wings. So I speculated that its lateral area will be largest at the center. This dataset shows peak position for each layer. The maximum point will be the center of each section. And the shifting manner implies that the structure is distorted, not the perfect circular. So I calculated that the structure is tilted about 88 degrees. So naturally it tells us it's somewhat ellipse-like shape, not perfect circular. For the last, I measured full width half maximum. This will be larger when the lateral area is large. In case of ellipse, it will have short full width half maximum at the top, maximum at the center, and lowering towards the bottom. And if you see the dataset on the left, width getting bigger at the center. However, you will also see it is not perfectly decreased after the center. So I suspected that this is not the perfect ellipse neither. So based on the image analysis, we roughly reconstructed the shape of tubule. Long axis was almost 11 micrometer and the short axis was 0.25 micrometer. As the long axis is larger than the short axis, we can assume that external stress was applied onto this direction. This distortion will narrow the absolute area of tubule, which leads to higher fluid speed. It means fluid will flow faster on the same stresses. So in this study, we suggest that the structural distortion of dentinal tubule is the main factor of hypersensitivity disease. So to sum up, I was able to measure cross-section image of dentinal tubules with two-photon microscopy. After the analysis of collected image, I found that the shape of tubule is not the perfect circular. The structural distortion lessens the area of tubule, so to create higher fluid pressure on the same stimulation. So through this project, I was able to suggest that the main factor of hypersensitivity is distorted shape of dentinal tubules by external stresses. And I would like to conclude my presentation. Thank you all for listening.